Thank you, sir. Thank you for your kind introduction. And at the outset, I must thank Dr. P.K. Agrawal for giving this opportunity to speak about my project in this learned audience. Aim of my presentation is to explore a model for prevention of NCD targeting adolescent, and its outline will be to define NCD, to give examples of NCD, to discuss about the risk factors, are they preventable, and to present an approach to this preventive model, how, when and where to apply, and who will help and support. So, respected chairperson, I start my presentation with a small story. This small boy with his father and grandfather visited a physician for treatment of this gentleman who was suffering from diabetes, hypertension and coronary artery disease. A year later, this gentleman visited with his son to the physician and he told, "I lost my father and I am also having diabetes." Years later, the young boy is now mature now, gaining weight, and is now a young youth, visited to the same physician and told, "I have lost everything in my life, lost my father and grandfather, and now I am also having diabetes and blood pressure." Doctor prescribed some medicine and the boy left away. And after that, the doctor was thinking, what mistake I made. So there was a regret. Oh, could we have done something for this young adult when he was a boy? Genetic factors are not modifiable, but epigenetic factors like nutrition, exercise, stress, sleep, water intake, pollution have an impact on epigenome. The DNA code remains fixed for life, but the epigenome remains flexible. Now let us see this cartoon. Who looks more healthy? We can see this modern man where his muscles are replaced by fat. But do you acquire it in one day? We can see gradually increasing size of tummy. And this is giving rise to all metabolic disease, fatty liver, coronary artery disease, and so on. Now, let us see who is at risk. This young boy enjoying pizzas, burgers, chow mein, this young man smoking with his kid, pregnant lady smoking. Is it not dangerous? Smoking together, enjoying a cigarette, and see the effect of screen time, social media, Twitter, Facebook, on the studies, on the academic performance. Now, let us see this cartoon. This is a real fact of life. And we see there is declining in the muscle mass, and this is sarcopenia. In morning we have already discussed about this. Nobody wants to be like this, and everyone sitting here want to be like this. But how? Let us see the muscle health scenario in Indian adults. 7 in 10 Indians have poor muscle mass and low protein level. 90% of Indians had higher body fat and 50% of them had higher visceral fat. Several studies have shown that increased body fat, especially visceral fat, is particularly damaging and greatly increasing the risk of diabetes, cardiovascular disease, hypertension, and certain cancer. Now, when we see the treatment of sarcopenia, the strong recommendation is to increase physical activity, and other recommendations are protein-rich diet or protein supplementation, and lastly, when we do a pharmacological intervention, it is beneficial effect of vitamin D. But my question is, when we should apply this physical activity, protein-rich diet, and plenty of sunshine? Which stage we need? At this stage or at this stage? or from the beginning? I think it should be from the beginning. Only then we can delay the effect of sarcopenia. NCDs are non-communicable, caused by genetic or lifestyle factors of long duration and slow progression. These are the largest killer of mankind and attributed to 41 million deaths globally, representing over 74% of all deaths. And according to the ICMR, current Indian data is 63% of all deaths are due to non-communicable disease. All these diseases are multifactorial, and lifestyle plays a fundamental role in their genesis. Modifiable behaviors such as diet and exercise interact with their prevention and treatment. Now let us see this study. Childhood obesity in India. Obesity affects 380 million children and adolescents worldwide. Low and middle income countries are the most affected region worldwide. If the current trend persists, India will contribute approximately 11% of global burden of childhood obesity by 2030. And in another study, in India, in 2019, 22.8% of school-going children are having childhood obesity. And according to the Lancet, 1 in 8 people are now living with obesity. And what Globe is doing? There is a vision of Globe, WHO, a world free of avoidable burden of non-communicable disease, and its goal is to reduce preventable and avoidable burden of morbidity, mortality, disability due to non-communicable disease by means of multi-sectorial collaboration and cooperation at national, regional and global level, so that the population reach the highest attainable standard of health and productivity at every age, and those diseases are no longer a barrier to well-being or socio-economic development. So in this context, 9 targets were fixed: reduction in the premature mortality, reduction in the consumption of alcohol, increase in physical activity, reduction in salt intake, tobacco use, blood pressure reduction, and reduction, the rise in diabetes and obesity. Now what is the real world scenario? Disability and mortality burden of NCD have risen worldwide. However, the NCD burden among adolescents remains poorly described. Adolescence is a period of major physical growth, psychological development, and shifting social relationship with major repercussions for health. It remains a neglected age group in the quest for universal health coverage. Period from childhood to adolescence is a crucial period for establishing healthy lifestyle that can last lifelong. Research has shown a healthy diet and regular physical activity in childhood can reduce the risk of chronic disease later in life. However, achieving a healthy diet and regular exercise in childhood can be challenging because of unhealthy food habits, sedentary lifestyle, and long period of screen time. There is also a link to NCD with communicable disease. Cancer of cervix, liver, oral cavity, and stomach have shown to have an infectious etiology. Vaccine against hepatitis B and human papillomavirus will reduce the burden of NCD. HPV vaccination is recommended at the age of 11 to 12 years. Carcinoma cervix is the second most common cancer in the female after breast, and in every 8 minutes, we are losing one woman. And if we calculate, it becomes 200 deaths per day. And when we see it at a global perspective, it is 4,93,000 per year, and see the contribution of India, it is about 27%, that is 1,32,000 per year death due to this carcinoma cervix. And it is 100% preventable. And what we need to increase the awareness. We can see in this graph that all diseases like cancer, ischemic heart disease, stroke, rising trend. projected global death by 2030. And WHO projects that over the next 10 years, the largest increase in death from cardiovascular disease, cancer, respiratory disease and diabetes will occur in low and middle income countries. So the tree, which is rooted by physical inactivity, alcohol abuse, unhealthy diet and tobacco, and flourishing as heart disease, diabetes, cancer, chronic lung disease and other NCDs, we must cut this tree. And let us see the Indian scenario. Government of India has implemented national program for prevention and control of cancer, diabetes, cardiovascular disease and stroke in all states across the country. It also comprises population-based screening program. But here, the age chosen is age above 30. So this national program again ignoring school-going children. So what is our model? Any organization of physicians like API, IMA, RSSTI, CCDSI can visit to nearby schools or other civil societies like Rotary, Lions Club, NGOs of their region, where they discuss NCDs and aware the children and adolescents regarding facts of non-communicable disease. This awareness will create a major impact in future. They can do a survey and collect data in the form of questionnaires, which contains questions regarding behavioral risk factors, knowledge regarding non-communicable disease, vaccination status regarding hepatitis B and human papilloma virus, importance of exercise, games and yoga, healthy diets. BMI and waist circumference can be easily assessed with the help of class monitor or volunteer. This will help us to assess the childhood obesity in school-going children. They can have an interactive session also, which will create confidence in young ones, which can build behavioral changes in future. And at the end, teachers of the school and members of different civil societies will become spreader of this concept. I am confident this model will be a great help for achieving national targets in coming decades. So we arranged a meeting with director and principal of local schools of Purnia, social activists, faculties from civil societies, and discussed this model, and we got huge response, and they all become ready to help us in this project. And we launched the project API चली स्कूल की ओर, करने संवाद किशोरों से, मिलकर करेंगे रोकथाम गैर संचारी बीमारियों का. Dr. A.K. Das, who is past chairman Bihar chapter, he helped me much, he encouraged me much, and we started and launched this program. And after that, भागलपुर के डॉक्टरों का भी मिला साथ. We can see here two governing body members, Dr. D.P. Singh and Dr. Hem Shankar Sharma are there, and they also started this program in Bhagalpur. And we got huge media coverage. किशोरावस्था में रोग के बारे में जानेंगे तो बड़े होकर बचे रहेंगे. 20 से 30 वर्ष में लोग डायबिटीज और ब्लड प्रेशर के हो रहे हैं शिकार. So if such news will come in media every time, it will really give an impact in the society. Guardians of the children. We arranged a camp at Terapan Bhavan in Purnia, and we can see here our chairperson, Dr. S.P. Singh, is sitting here. He is delivering lecture to the society's people and children, addressing children. We arranged another camp at Bright Career School, and it was a huge camp, and we can see here one governing body member, Dr. D.P. Singh, is here, and many members of API Purnia, Dr. Ajay Kumar is sitting, Dr. Arvind Kumar is sitting, all were present in this meeting, and again we got a huge media coverage. And another very large camp, about 1,500 students were there in the Vidya Vihar school, and there we can see the boy, the class monitor, they are measuring BMI, taking height, weight, and we can see here this interactive session. These girls, young girls, they had many questions. They are curious about their diet, exercise, screen time. So it is a very, very interested program, popular program. Later, and there is a role of NGO, and we got invitation from Lions Club of Purnia, and they also help us. API को मिला Lions Club Purnia का साथ. So they also started and helped us in our project. So we have a survey questionnaires, very relevant questions, and if we solve these questions, if a school-going boy or girl solve this question, that will itself increase their awareness towards the non-communicable disease. We explained the message of WHO that there are 4 diseases: cardiovascular disease, diabetes, cancer, chronic respiratory disease, and there are 4 modifiable shared risk factors, that is tobacco use, unhealthy diet, physical inactivity, harmful use of alcohol. We have described the bad effect of junk food, alcohol, and we told the importance of body mass index, how to maintain your body weight. We explained about the risk of cancer from alcohol and tobacco. We also explained the benefits of outdoor games to the school-going boys, benefits of yoga, and we provided them a handout of NCD. Now, who will help us? We will have to help ourselves. That means we should have strong determination. Of course, school director, principal, class teacher, social activists will help us. Monitor of the class will help us in body record, height measurement, and waist circumference measurement. Local organization of Rotary, Lions, civil society will also help us. I request you to adopt this program at your district, city level by engaging nearby schools, whether government or private.
Excuse me, sir.
A proposed guideline by our past chairman, API BIHAR, Dr. A.K. Das, is 30 minutes pre-programmed discussion with school teachers and faculty regarding NCD and importance of primary and preborder prevention. 30 minutes for questionnaires to students of class 6 to class 10, and 60 minutes for discussion on the question with the students. That will be an interactive session. We can force government also, education department also, if we have data, if we have numbers, that to add a chapter of NCD in the syllabus of school-going children. That is very important. We can also force school administration for provision of healthy food instead of burger, pizza in the school canteen. And there should be a mandatory game period and yoga session in every school, and they must appoint a NCD counselor in every school who may also be engaged in yoga training. So finally, the take home is target school-going children and adolescents, explain the impact of healthy diet and exercise and their interplay on the risk of non-communicable disease, believe in primary and primordial prevention. Now, Children's Day is 14th November, and 14th November is also World Diabetes Day. So, there is a relation between children and diabetes, and we know only school can break this connection. So I request you all adopt this program, API Chali School Ki Or. Thank you very much for your patient listening.